Hey everyone, in this lesson we're going to talk about pyruvate kinase deficiency, or PKD. So what is pyruvate kinase deficiency? Well, it is an autosomal recessive disorder of deficiency of the pyruvate kinase enzyme, leading to hemolytic anemia. So individuals can be heterozygous or homozygous for this condition, but typically homozygous individuals have a worse prognosis. Now, PKD is the second most common red blood cell or RBC enzyme defect. But it is the most common cause of RBC enzyme-related hemolytic anemia. And PKD leads to a non-immune hemolytic anemia. Non-immune because it is a defect in an enzyme as opposed to an immune system-mediated destruction of blood cells. So what is the pathophysiology of PKD? Well, it all relates to a mutation in a gene known as the PKLR gene. Now, the PKLR gene encodes pyruvate kinase enzyme, and it's located on chromosome 1 in the Q arm at 21, or 21. And there are two isoforms of this enzyme. There's a liver or L isoform, and then there's a RBC or R isoform. Now, this is the glycolytic pathway. So really the pathophysiology relates to the glycolytic pathway in that pyruvate kinase is suppressed. So this will lead to an inability of the red blood cell to process PEP or phosphoenolpyruvate to pyruvate. So phosphoenolpyruvate levels would increase. Now this can lead to a backup in the glycolytic pathway, leading to more production of 2,3-bisphosphoglycerate and other intermediates in this pathway as well. And this ultimately leads to the red blood cell being deficient or unable to produce enough ATP. And the reduced or lack of ATP production leads to cellular dehydration, and this alters the RBC shape, making the RBC more rigid. And the red blood cells, once they are deformed, they become removed by the spleen, and this leads to anemia, but also because there are problems in the structure of the red blood cell, this can lead to decreased hemoglobin affinity for oxygen, and this usually shifts the oxygen dissociation curve of hemoglobin so that the hemoglobin has less affinity for O2. So this is all because we need ATP for ion pumps. So this all leads to problems and deformities in the red blood cell, which lead to removal by the spleen and a general reduction in function of the red blood cell. So what are some of the signs and symptoms of PKD? Well, one of the main signs and symptoms of pyruvate kinase deficiency is chronic hemolytic anemia. And you can imagine it's because the spleen is really removing a lot of red blood cells. Now, another thing that leads or that also co-occurs is splenomegaly, or an enlarged spleen. And this is because the spleen is really hard at work removing red blood cells from circulation. So again, your spleen really enlarges because it has to take care of more and more red blood cells. It has to remove those red blood cells, so it enlarges to compensate. Now, there's also an issue with jaundice. Now, this is because more red blood cells are being destroyed through hemolysis. This leads to hemoglobin destruction and bilirubin production, and it eventually leads to jaundice. Now, there's also neonatal jaundice. This is very common with PKD, so a lot of times this condition can be picked up during neonatal periods because of excessive jaundice or prolonged jaundice in the neonate. There's also hepatomegaly, and we'll get into the reason why that is in a moment. And as I mentioned before, due to hemoglobin destruction, their hemoglobin metabolism, we get increases in bilirubin, so we get hyperbilirubinemia. There's also gallstones, so the increase in bilirubin actually leads to an increase in production of gallstones. Now, there's also skin ulcers. This can be because there are higher levels of hemoglobin in the bloodstream, more than the body can actually get rid of. So this can lead to problems in skin and skin ulcers. Now, there's something known as secondary hemochromatosis. Now, hemochromatosis is when there's iron overload, and this can lead to iron deposition within the liver, because if we're really destroying a lot of red blood cells due to a chronic hemolytic anemia, we can get a secondary iron overload, and then the iron will be deposited in certain organs such as the liver. And there's also aplastic crisis, so this can occur when an individual is perhaps infected with a virus. This can lead to an even further hemolysis of red blood cells. So how do we diagnose pyruvate kinase deficiency? Well, one of the ways is to do a blood smear. And one of the kind of atypical cells that are found in pyruvate kinase deficiency is an echinocyte. And an echinocyte are these very oddly shaped cells with spicules, and they also have central pallor. So you'll see these spicules kind of bulging out due to the misshapen red blood cell, and you'll see like a central pallor as well. Now, another way to diagnose PKD is simply through a pyruvate kinase activity test. So you would see a lower activity of pyruvate kinase simply because there is just less pyruvate kinase enzyme. And this is considered the gold standard in PKD diagnosis. And as I mentioned before, you'll see a decreased enzyme activity with this test. And there's also genetic testing, so individuals can be tested to check to see if they have a mutation in the PKLR gene. Now, when we diagnose PKD, how do we treat it? Well, treatment depends on the stage of life. So in prenatal, there are different problems that occur. One is fetal hydrops, so this may require intrauterine transfusion. During the neonatal period, as we mentioned before, there's jaundice. We might need to deal with hyperbilirubinemia. So this might require phototherapy or exchange therapy. And from childhood to adulthood, there are several things we can do to treat PKD. One is simply an RBC transfusion. Another one may be folic acid supplementation, chelation of iron due to that iron overload or secondary hemochromatosis. And in severe circumstances, we may need to do a splenectomy or remove the spleen of the patient so that less red blood cells are destroyed by the spleen. So anyways, guys, that was a quick lesson on pyruvate kinase deficiency. I hope you found this lesson helpful. If you did, please like and subscribe for more videos like this one. And as always, thank you so much for watching, and I'll see you next time.